Uh-oh. So welcome and introductions. My name is Allison Morris. I'm the president and co-founder of We Reign Sickle Cell Corporation. We were established in February of 2023. Walter Clement Noel, the sickle cell proband, that means he's the first of his kind that was discovered, was born on a large estate in the hilly bush country at the north end of Grenada, a small Caribbean island that at the time was a British colony. His family was wealthy landowners. Despite chronic health problems, Noel received a quality education and attended Harrison College in Barbados, completing his undergraduate studies in the summer of 1904. In September of that year, Noel sailed from Barbados to New York on the SS Cyrenus. He developed a leg ulcer, which is a common complication of sickle cell disease, during the week-long journey. After customs and immigration processing in New York, he sought medical attention and was treated with topical iodine, and the leg wound quickly healed. Noel then traveled by train to Chicago, where he had been accepted as a dental student at the Chicago College of Dental Surgery on the city's west side, and he took a room on West Congress Street in the heart of Chicago Medical District. It was unusual in 1904 for a student of African descent, such as Noel, to be permitted to study in the United States outside of a traditionally blacks-only school. However, Noel was well-to-do and also a foreigner, and educational opportunities for black students were slowly beginning to expand. In late 1904, November, Noel developed respiratory problems, now recognized as the leading acute cause of death in patients with sickle cell disease. And it persisted for about a month. He finally sought medical attention at the Presbyterian Hospital in Chicago, which is a private facility, and was evaluated by an intern, Ernest Irons. And Irons performed a peripheral blood smear, which was a relatively recent addition to the clinical testing battery, and noted that Noel's blood smear contained many pear-shaped and elongated forms, some small, so they noticed changes in his blood. Irons discussed the case at length with Herrick, his supervising physician. A thorough search for potential causes of these oddly shaped cells were unrevealing. Malaria or a parasitic infection was suspected but not substantiated. Throughout the next 2.5 years, as Noel progressed through his dental studies, he experienced several illnesses. He was hospitalized briefly for bronchitis and later confined for 2 months at the Francis Willard Hospital for a bilious and muscular attack, which we know is now as a vaso-occlusive crisis. And he also had pigment gallstones. Irons also made house calls for Noel's, he made notes, and he made house calls for Irons' knee pain, or for Noel's knee pain and for bronchitis. And so he gave all these findings and all these journals that he made, he gave them to Herrick, which was his physician, and that was the end of his training. Irons later achieved distinction as a rheumatologist. He was president of the American College of Physicians and the American Medical Association in the 1940s. I want to pause there because an intern basically discovered this because he took interest in someone that didn't know what was wrong with him. You know, we didn't have sickle cell disease, so he didn't know what was going on. But that's what we need to spark in our medical professionals is, if there's something that you don't know, let's find out. Let's not just throw, medication or things that we know. Let's challenge the system as it is now, and so we can help. And that's how the cure has been developed, is because people are challenging what we know versus what we don't know. We want to find that out.